Thank you very much to all of you for taking the time, making the effort to travel, some of you thousands of miles to join us for this conference, and also preparing for this conference by participating in meetings prior to traveling here. So I want to start by asking each of you to introduce yourself. And as you do that, please tell us a little bit more, as much as you are comfortable, about your journey with kidney disease as a patient or caregiver. And we'll start at you.
Hello. Good morning. So my name is Bernard. I'm a kidney patient actually. Nephrotic syndrome. I had nephrotic syndrome in 2018, late 2018, that way. So the journey has been hectic a little, but we are still surviving. So I'm just glad to be here with you guys. Thank you so much.
Good morning to everyone. My name is Angela Opokua Afonope. Bernard is my brother, so a family member and a caregiver. Concerning the topic today, I'm actually excited to be part of this conference because it has not been easy at all for the family. I mean, when he was diagnosed, it was something very tough for the entire family. My mom especially couldn't pick it, but by God's grace, he's still alive. So we are happy to be part of this conference. Thank you.
Hi, good morning. My name is Irabna Niniwadakwa. I found out I had kidney disease in 2018, and it was a bit challenging. I mean, to find out you have it, it psychologically affects you, because I walked into the hospital one day to donate blood. Then they tell me my BP is too high, so I should go get tested. Luckily for me, my doctor felt that, okay, he needed to do more examination. And so a kidney test was done. And I think then my creatinine was around 109. So it wasn't so high, but then I was alarmed because I was just about, I think, 27, 28 thereabout. So it was scary. And I had palpitation, I had panic attacks, the mental stress. And being African and being Ghanaian, there isn't so much support for mental health in terms of when you're going through all these things. So you have to wait it out. You have to be strong. You have to be tough. Luckily, I come from a very supportive family. I think my dad is at the far end. He went with me for my first, he and my brother, they went with me for my first doctor's appointment to see a nephrologist at Kolebu. And it was pretty scary because Kolebu is the biggest hospital in Ghana. You walk in there and you see all kinds of things. And I would go to Dr. Edu, my doctor is here, and anytime I had an appointment with him, it would scare me. Not because I'm going to see him because he's the nicest person, he's going to have time for me, all his staff are. But the thought of going to Kolebu scares me. You would probably somebody with a very big head, somebody with some blood oozing out from somewhere. It gets scary. It gets scary. And in between that, I had a baby in 2022, and it was tough. It was tough. But the interesting part of it is that during my pregnancy, my kidneys were normal. My readings got to normal, and it was exciting. So I remember telling my doctor, then I should probably get pregnant every year so that I'll get good kidney readings. So, but then he's like, no, you can't put that strain on your kidney. So I'm glad to be here. Listening to all the speakers, it's been very exciting to know about all these genes and all these things, even though sometimes I get really lost with all the terminologies and all of that. But I'm grateful to be here. Thank you.
there we go. Hi, my name is Taylor Jefferson from Dallas, Texas. My mom is Nicole Jefferson. She's sitting right there. We started our kidney journey, well, her kidney journey rather, in 2003. So I'm not going to tell my age, but I was 13. So just do the math. So we've been doing this for quite some time, and that's when I became her caregiver, as it's always just been me and my mom. So we've been rocking and rolling for about 21 years doing this, and she's a two-time kidney transplant recipient. So I've been there for both of them, and yeah, it's been a journey.
Hello. First, I want to thank the speaker, the patient before, who added some levity to this really serious discussion. So thank you for that. I'm Janelle Speller. I'm from Chicago. I actually work in healthcare policy. I have been doing this since graduating from college. And it was during the time that I was developing quality measures. I was on a panel to develop quality measures on CKD and ESRD that I started my own CKD diagnostic journey. So I knew too much, right? And it was still terrifying for me having all that knowledge. I was diagnosed with CKD in 2007, 7 months after having my third and final daughter. So lots of fears. I was in my early 30s at the time, again, knowing way too much. And then my FSGS diagnosis was confirmed upon biopsy in late 2008. I am also a 2-time transplant recipient, and the journey for me started way before all of this research was done. So I was in a knowledge vacuum where care wasn't the greatest. The diagnostic journey was very, very long. And me doing education of physicians and other providers in the process while battling this very, very tough disease. My caregiver is in the audience taking pictures right now. My husband of many years, we're high school sweethearts. But the other story that was told about the medical student who was trying to donate to her mother, that happened in our family, where my oldest daughter went through that process. She was tested and has the variants. And then that was it. She was left on her own. So here she is worrying about me, 6 years on peritoneal dialysis at that point with nothing in sight. And here she is 21 years old, or actually 18, worrying about her own care and seeing what I had gone through prior. So I am really glad that there's more research. I have more questions regarding testing. If there's not appropriate education, follow-up, awareness among the PCP and nephrology community, why, right? What do we do afterwards? So a lot more questions than answers. Thank you.
Hi, I'm Nicole Jefferson. I am from Dallas, Texas. I am a 2-time kidney transplant recipient. I received my most recent one April 23rd, 2020. So I just celebrated my kidney anniversary the other day on my way here. So that was somewhat symbolical and sentimental for me. As Taylor stated, she's been my caregiver for a long time. I was diagnosed with kidney disease when I was 31. So it was a really trying time because I was young. I was just starting my professional career, getting it kicked off. And I had to raise a daughter who was very active in sports. So I just knew I could not just sit there and wait on kidney disease to eat me up. So I decided to do peritoneal so I could continue to work and things like that. As far as genetic testing and things like that, I learned about it, I guess, about a little bit over 10 years ago, and I was speaking somewhere, I believe at Harvard, and I met Opie, and he scared me with his talk about APOL1. So since then, that's when I've been trying to learn everything I could about it, and then when the Apollo project started, I was the chair of the committee advisory committee for that for a very long time, and I do still sit on the advisory committee with several people here. So that's been very enlightening, and I've been obtaining information that way. When I was looking for my second kidney, I went to several transplant centers all over the U.S. trying to get a kidney the quickest way I could. And in the location in our hometown, one of the major medical centers, they wouldn't test my daughter for the gene. They would test her. They said, yeah, she's okay. She can perfectly donate, but they would not test her for that gene. So at that time, I said, absolutely not. I would not take it unless they did the testing, and I just told them I would wait on a deceased donor unless they decided to do the testing. And the reason they didn't do the testing is because, like we all stated here, there's nothing they know about it. There's nothing they could do, which understandably, but that's something that as a patient and as the mother of a daughter, I still wanted to know if she had that. Thank you.
Hi, everybody. My name is Joshua Albright. I'm a patient. This is my caregiver right here, my mom. I was diagnosed with kidney disease at 18 years old. I'm 21 years old now. And I basically was diagnosed almost on accident. My aunt had just given the kidney away to a close family friend, basically a family member, and I happened to stop by their house just to say hello to her, say hello to my cousins, my aunt and uncle. And they're playing around with a blood pressure machine, and I happened to use the blood pressure machine and noticed that my blood pressure was extremely high. But me at that age, I didn't really know what that meant. And it was actually my uncle who mentioned to my mom that my blood pressure was really elevated for my age. And I was just extremely blessed to, have my mom in my life, to be very active with my health. She's been like that my whole entire life. So as soon as she noticed the blood pressure was high, she immediately contacted some doctors. And within the next day, I was able to go to urgent care and so that they kind of figure out what was going on with my high blood pressure. And within my first visit at the urgent care, within 7 weeks, I was able to have a kidney biopsy, genetic testing, and I was also placed into a clinical trial, which extremely has helped the reason why I'm still so healthy today. So because I was able to do the genetic testing and the screening for my kidney so early, we caught my kidney disease at about stage 2. So my kidney function was still okay, and my clinical trial really helped with my progress and my journey with kidney disease. And I'm still only at stage 2, and I think every single couple of months I've only seen my levels be better and my kidney function be better, and I've gotten healthier. I've been able to learn so much about this disease and learn so much about the research and stuff that's been going into finding out more about APOL1 mediated kidney disease. So it's just been very important part of my journey to share my story and share what I've learned, because I can kind of see the advances in research and how some people's stories were a lot different than mine, and they didn't find out so quickly, and they didn't know what was going on right early on with their diagnosis. So I'm just very blessed to be here and glad I'm able to share my story. So thank you, guys.
And my name is Jamie Albright. As Joshua said, I'm his mom. And he mentioned that my sister had donated a kidney. And actually, Joshua only went with us because he just got a new car and he wanted to show my brother-in-law. I always have to clarify that.
I didn't want to say
finding out he had high blood pressure, my children, I am kind of a bulldog. We have 6. They go to every annual physical, every basketball sports physical. He had just been to the doctor. So completely unlike me, I had my husband take him the next day, and he texts me, and all he said was, they won't let us leave. And I'm going, that's not good information, So my husband was kind of like, oh, something's wrong. So we got him into CHOA quickly. And I will say, getting him into the children's nephrologist, I could tell the difference compared to what we experienced when my second son was diagnosed in 2022 as an adult. I remember the doctor saying all of these things to me, the pediatric nephrologist, and I was listening, and I feel like I'm an educated person, but nothing was sticking. And at the end, I looked at her and said, what would you do if he was your child? Because really, I'm not a medical professional, and I just need to know as a mom, what would you do? And she said, I would not start the steroids. I would do genetic testing, and then I would go from there. And so that was amazing advice. And Joshua was just turning 18 like 3 days later, so that made him eligible for the clinical trial. His experience has been wonderful. Home visits with the nurse. He and his doctor text and joke and have a phenomenal relationship. And so when I've heard other stories, I want to see his journey be more of the norm for people. Also mentioning my sister, she has never had genetic testing. So she donated a kidney, and is having some struggles now. She is scared to death to get genetic testing because of her kids, right? And so I also don't understand how she was able to donate a kidney and not have this genetic testing. So, that's our story. I'm just a mom who's being supportive of my son, but also kind of trying to see how we can be part of making a positive difference.
Good morning. Good morning. I'm Kevin Mott. I'm from Chicago, Illinois. And my journey with kidney disease started about 2000, 2001. I was having a problem with migraines, and I went to a doctor to get treated. And actually, I'll try to make the story a little short. Actually ended up having to go to 3 different doctors because I felt that I was really being seen more through the lens of their various biases as opposed to really spending time with me to get to know me, get to know about my lifestyle and things like that, to the point where I ended up in an emergency having to see a doctor. The only doctor I could see that day was at a women's clinic. That was the first doctor that I had ever had a dialogue with out of any of the doctors I had seen previously. So I asked her to let me stay with her, which she did. And we still had the same issue where I was trying blood pressure medications and nothing really worked for me. But at some point she said to me, based on what I know about you, it doesn't make sense that we're having this hard of a time controlling your blood pressure. So I want to send you to a nephrologist. And so I went to a nephrologist, and somewhere around 2002, maybe 2003 is when I discovered that I had FSGS. And I'm very fortunate. I've had the same nephrologist the entire way. I never had to go on dialysis. And in about 2015, she said to me, "You're probably about 2 years away from going on dialysis. You need to start telling people," because I hadn't actually really told anyone except for my wife. And then even more fortunately, a friend of mine from college donated a kidney to me in 2017, and I've been doing well ever since. And in about 2020, I took the test, genetic test through 23andMe, and discovered that I do have the APOL1 genes. And so I'm here. I've been very engaged ever since I recovered from my transplant operation. I'm on the board of Nephrology Kidney International, and I really do appreciate the opportunity to be here with you all.
Good morning, everybody. My name is Victor Ezibe from Nigeria. I want to thank God for giving me the grace to be here present today and for keeping our lives since I had my transplant, and for using my doctors who is here present. Professor Ulasi is my doctor. My problem started in 2002 when I was diagnosed of having CKD kidney disease. And so the journey started. The journey has been a very long one. I categorize my own experience as my experience when my kidney was discovered, when I was discovered having this disease. Then my experience when my kidney finally failed. Then my experience when I went to India for transplant. And this problem was discovered in 2002, and I had my transplant in 2008 in Sterling Hospital in India. I have my experience after the transplant was done, and then the experience now I'm being managed as a transplant patient. I want to say that the journey of a kidney transplant person is quite a long one and quite devastating and traumatizing. It's not easy for one to be a kidney transplant person. In fact, if you are diagnosed as a kidney transplant person, it brings a lot of trouble in your family. Every place will be on fire. Everybody around you will be on a high hill because it is high demanding. It takes a lot of money. It takes a lot of things for you to be managed. It's a very Herculean task, and it's not easy. If you are transplanted, it is not easy to maintain you and manage you, because the drugs you take, which is your routine medicine, you must be taking it every day. whereby you don't take it, you will suffer what the nephrologists call rejection. And the most problem we experience this time around is that our drugs to maintain us as transplant persons are quite very expensive this time around. So I thank God that we are here today to have further experience on how to manage us as transplant persons. In fact, in Nigeria now, we have many of us because this problem is like it is too much in Africa. And more especially as I have learned from the lectures given this morning, that is more prevalent in West Africa and Nigeria and even Ghana here. We have many of us there. And because we have many patients of this kidney disease in Nigeria, both those who have been transplanted and those who are yet to be transplanted, we now formed ourselves into a little association. In Anambra State, we have now Kidney Transplant Persons Association of Nigeria, Anambra State branch, of which, by the grace of God, I'm the chairman. We formed this association in order to reach out to people, in order to sensitize the public, and how to help our fellow members to maintain ourselves and manage ourselves, because it's not an easy thing. And also to reach out to philanthropists who may, in one way or the other, come to our help, because the drugs we take are quite expensive and not even easy to reach. Because some of these drugs come from abroad, and it's not easy to get them. This time around, because of the high cost of dollar and other things involved, many of us are even finding it difficult to survive. So I thank my doctors and thank the organizers of this program for bringing us together to have more experience of this disease and how to manage ourselves even in the future. So thank you so much.
Yeah, I think it's good. Still good morning. My name is Godfred Dakwa. And Irabna Ninwa Dakwa is my first daughter. Her news was broken to us in 2018. And I accompanied her to the hospital Kolebu to understand the whole thing. We went and we met Dr. Du, and then another doctor, Safu, the next subsequent time we visited. And the way she was complaining, we did not know what she actually means. And every time he comes home, he goes to the laboratories and comes with the laboratory results. And it frightens all of us. When she was pregnant, what she went through, and after the pregnancy till today, that we are experiencing that is going down. I mean, we are seeing that it is subsided. And as a result, what happened to me was that it created an eye-opener. We don't have a lot of kidney educators around, kidney disease educators around. So the public is not too much informed. Where I'm coming from, even in Akosobo, it's quite a civil area. People are not too much knowledgeable about kidney and then prostate. And it's killing a whole lot of people. So for my daughter, I also started checking up on myself. And then I went to MDS Lancet, which I do total test every year. And some of the times, twice in a year. I went to test and they said I was above the range. So it means that I was also having the problem. I came when that was 2021. I went to the night. I said, no, I disagree. I would not accept it. So I was thinking about it in another way. Some of us Africans, we also believe in the spiritual aspect so much. So I decided that this might be spiritual. How can it affect my first daughter and myself? So I was there 1 week, around 2:00 in the night. I had a voice. Let's wake up, rise up. Asked me to pick a bottle of water. I picked a bottle of water. Started praying over it. For 30 minutes, I drank the water. And then I waited for 1 week. I went to the same laboratory, and I came to the minimum range, reference point. So mine is something, and from that time, I keep on testing. And even just last month, I did a test, and we did a range. So it is prevalent in Africa. I like this particular conference, looking at it from the scientific view and doing the research. I'm a researcher myself. I want a PhD. But at times, if we can give the opportunities to people who are strongly with the Jesus Christ, some of these things will go through. And I believed in that, and I don't have any problem again. I don't take a medication. It's gone down. It's within the range. Every time I go and check, it's within the range. So I thank you. But this conference is becoming a great eye-opener. There are so many things I didn't know. But as the speakers keep on speaking, I've seen that there are so many things you know. So I'll plead that the dissemination of the information should go everywhere so that we in Africa will learn so many things from it and we can help ourselves and avoid some of these things. Thank you very much.
Thank you for sharing your story with us and trusting us with that information to treat it gingerly and with respect. So I'm going to, our questions to you, any of you can answer the question as you see fit. I'm going to ask you, first of all, to members of the panel to look at this audience. The people that you are looking at are excellent clinicians, world-class scientists, and an organization that is committed to advancing cure and prevention of kidney disease. If any of you were to tell them something that they don't know, or something that you think should be a priority for them in their research, in their care for patients, what would that be? What do you think doctors, not just your doctor, because you don't want to accuse your doctor of ignorance, but what do you think healthcare providers?
I'll go.
Go ahead.
Well, obviously, you all are extremely talented, very brilliant people. I think one of the things that, as a patient, that I would want all doctors to understand, especially working on a disease like this, where there isn't a cure. We don't necessarily have set treatments. You know, there is no 10-step plan for what a patient is going to go through. That one of the most important things we have to do is you have to build trust, because at some point, I think in most people's journeys, I mean, Josh's journey is way on the other side of the bell curve from what a lot of people experience, but most of us are going to have an experience with our doctors along the way where you prescribe a treatment or a plan that really doesn't work. And so we know something's going to happen that isn't going to work. What's important is what happens after that. So when you give me the drug that gives me a side effect that doesn't allow me to continue my day or continue my work, all right, do I trust you enough to say, okay, that didn't work, or that really made me sick, let's go with the next thing? You know, that's what's really important. And I understand that you all are, or just nephrologists in general, you don't have much time, especially in the American healthcare system. You know, our doctors are having to see so many people a day, but somewhere along that line, somehow, a level of trust needs to be there so that along the way, when something doesn't work, it's okay. We'll just go back. We'll try it again. We'll try the next thing, where we can get to a point where it's collaborative, because that's really, you know, what it's going to take. With myself and my nephrologist, you know, I called it medicinal roulette. That, like, we were just trying so many drugs. You know, when people ask me, well, did you try this drug? I probably did. I didn't even keep track of them, right? But I trusted her, and I felt that she listened to me, and I felt that she was doing the best that she could. So when something didn't work, or like I said, a side effect was just too much for me, I was comfortable saying, all right, well, let's try something else and keep it going.
I want to add to that to make sure that you are listening to the patients. If they tell you something, believe it. With my failure of my first transplant, my nephrologist told me my kidney was not failing because of the numbers. However, I demanded a biopsy, and that's when he found out, yes, I was in failure. So I was able to get that second kidney before starting dialysis. So listening to the patients. As far as clinical, make sure that you have the patient voice included. one of the things that we talk about in the Apollo project is how, as the patient advisory board, the clinicians and things, they get to ask us anything they want to. In one of our meetings, we were heavily involved in a meeting, and even in a breakout group, Barry came in and said, hey, we have a question that we want to ask patients. And so he stopped at that time instead of even going on and said, let me go ask the patients. And he brought us into the discussion to get our advice. So make sure you are getting the patient voice.
Can I answer as well, please? Yeah. From a caregiver standpoint, of course, like I said, when my mom got diagnosed, I was only 13. So she was like a super advocate for making sure that my pediatrician was testing me. And so even now, I still get tested. I get routine blood work, and they always are checking like all of my levels because we don't play that. And I've seen how it was with my mom. So definitely, if you have a patient that does have young children, as she stated before, that she has daughters, and her daughter ended up testing, and like my mom said, they wouldn't test me for APOL1. So just making sure that you can add that into their routine panel so that we don't have to experience that as kids, because that was scary. Like, I'm sure your daughters probably were scared. I mean, I saw my mom go through it bad, and I just didn't want to experience that. So yeah.
So we have a long list of questions. Can I say one more thing? I think in a sense we're preaching to the choir here, and it's really incumbent on the audience here to share with your colleagues, right? It's the trust, it's the stigma issue, and then what I felt along my however many years journey is the expectation that I was going to die, right? It was the countdown, the 5-year average mortality on dialysis, I made it to 8 years. But all along, it was like, oh, you're Black, one, in America. That's stigma. Black woman with chronic kidney disease and stage renal disease. I kind of did it to myself. So there's a lot of education that needs to be spread from this audience across to other physicians and other providers.
Okay, thank you.
Yes. Please. As a world recognized organization on this kidney issue, I want to ask, what effort are this body making to help the patients, both transplanted and those yet to transplant, have easy access to their drugs? Because I know that those patients who are either those sickle cell patients or those who have been diagnosed of HIV, in most places, they have free access to their drugs and medications. In most places, they get their drugs free of charge. So I want to ask this honorable body, what effort are you making worldwide to make sure that your patients, those that have been transplanted like myself, those that are yet to be transplanted, what effort are you making to make sure they get their drugs? Because there's one thing in this matter. It is easy to transplant. It is a very difficult time to manage a transplanted person like myself. Because if you don't take your medicine, if you don't have access to your medicine, especially this time around, you are doomed. You must die. And if you don't take your medicine, you must die. So I want to find out the effort you are making, because if I get home now, they will ask me, what did you achieve there? I will tell them that I was able to pass their message to you people. Because you are the people that will speak to government. They make these medicines available to us. They make us to have free access to it, or let them subsidize the price of these medicines. And again, it is important you work on the uniformity of these medicines, because there are many of them. You have Pancraf, you have Prograf, you have Tacrolimus, you have all this and that, and all of them are very exorbitant prices. What effort are you making to make sure at least you have a kind of having a streamlined medication to this problem? Thank you, and God bless you.
Okay, so I just want to touch a little on education. I think that it's important that we spread the news. Most of us didn't know about this before we came into this conference, or at the time we're being invited to be part of this conference. So I think that the education and information about this kidney disease should go beyond the patients and the family. It should go into the entire community so that most people will be aware. I mean, creating the awareness is most crucial to this discussion. Thank you.
I'm so sorry. Have you ever heard of APOL1 genotype? Have you ever heard of any other type of genotype analysis? Have you ever been asked to run the test, to have a test? Did you hear about the test before your kidney disease, or was it when you started seeing your doctor that you heard about it? Because it's important, we need to understand so that we know how to, spread the word like you're saying. Yeah, thank you.
Okay, so for me, I think I got to know about APOL1 last year, or is it the beginning of this year? I'm not too sure. I think Dr. Edu would know, because that was when I was called on, and I was like, okay, there's this. I think I started hearing about it when they were doing the VTEX trials, and the phase 1 had started, and they had asked if I wanted to be part. And I remember saying, nah, not really, because I still want to have kids, and I don't know how all that drug would do to my body. So I think last year, ending of the year, that's when I heard about it. And I got tested this year, I think around January. And when they told me about it, it was the first time. I had not heard of anything like that. You hear of autism spectrums, and they are all over. You get to hear of all these things. But APOL1, even I have friends, doctors, I tell, and they're also fascinated about it because they don't know about it. And in our part of the world, sometimes I think when you take 10 Ghanaian, probably 2 people have, or even more, have kidney disease. And because we don't really do routine checks. We don't. We just walk around, and when you find that you have an issue, that's when you run to the hospital, or you just go to the nearest chemist and you tell him, oh, I have a headache. And they give you some form of paracetamol or something. But so for me, when I found out in 2018, even though they would tell you to do the kidney test every 6 months, I was doing mine every month because, I wanted to know. And it wasn't so expensive to check then. I think it was less than $20 to just check for your kidney, creatinine, and all of that. So yes, most of us don't know about it, but I think we should know more about it. It should probably be on our NHIS system to make it accessible for everybody in Ghana, if I may say, because it looks as if it's very prevalent here. And my dad was telling me a backstory. Where we come from, he says there was a tetefly infestation some years back, way before I was born. And the government had to come spray the whole place with all of that. So I look back and I'm like, I can imagine the number of people in my village that has APOL1, and they don't have the slightest idea. And, as Africans, as much as we believe in God, we would definitely attribute it to some witch or some wizard or something. And so it even makes it difficult for you to even approach them and tell them about the scientific nature of it and how to even get drugs on it and how to even manage yourself. And so as everybody is advocating, I think we need more education. It should be drummed into our ears, just like HIV is everywhere. It should be drummed into our ears. Thank you.
Have not been tested. I became aware of APOL1 very early because I am in the healthcare research community, and I asked my physician repeatedly to be tested as recently as this year. But there is a reluctance among the physicians that I've seen, and I've seen many, not like Kevin with just one. and there's just a refusal. It's just like, it's pointless. You're on kidney number 2, we know it's pointless. So I think for those of us who started our journey pre-APOL1 discovery, there's some, guidance, some discussions that need to be had about how to manage us, especially those of us who haven't been tested.
Sorry. So specifically for me, I was introduced to the genotypes and specifically APOL1 because I had to get genetic testing done to qualify for the study that was introduced to us. And it's just extremely important for that genetic testing to happen because, like I said, some genetic. So I have a huge family, my mom and dad, and then it's 6 of us. So because I was introduced to the genetic testing and all my siblings were able to understand that I had a kidney disease, but not just something that was caused by, what people stick on to what kidney disease is, especially with our culture, is just bad health or bad habits or bad eating habits. But because it was genetic, we were kind of awake to figure out that this is something that our whole family should kind of address. So after I had my genetic testing done, again, my mom and my family were very active on getting it done for not only me, but my other siblings. And because we knew what was going on, my older brother, Jordan, who's usually with me when I speak, but he's not here with us today. He's back in Atlanta. But he was actually diagnosed with the same exact kidney disease, FSGS, APOL1 mediated. So genetic testing is very important when you're diagnosed with something that is genetic so that you can know and catch disease earlier for other people in your family. And I'm just hoping to continue to speak on it and advocate for it because before I was introduced to the genotype, I never knew what it was. And I don't see, if I wasn't diagnosed, I don't see what day I'd be walking around up the street and somebody said, hey, do you know what APOL1 is? Because that's not a conversation anybody is having unless you're actively in these rooms. So, it's just it's very, very important. So.
I know we're short on time, but I just want to give an example. In our community, one county over, a young man, 18 years old, literally story so similar to Josh's, except he collapsed and had to have both kidneys removed, FSGS. That is the difference in early detection. I've been able to connect with his mom, and like me, had her child at the doctor every year, had physicals, not understanding why we're very aware of sickle cell, and we've never heard of this.